Areas of special concern in regard to unnecessarily forceful examinations include abdominal examination, examination of gallbladder and liver, eliciting CVA, costovertebral angle tenderness, and examination of the ears with the otoscope and throat with the tongue depressor. These exam maneuvers are permitted, but do not be unnecessarily forceful in performing them. Equipment. There are a few pieces of equipment to demonstrate. First, each room has a small stool or chair for the clinicians to sit on if they wish, and on that stool or chair you'll find the sheet or drape for the standardized patient. There is only one blood pressure cuff size in the room. It will fit all of our standardized patients. The ophthalmoscope and otoscope. The ophthalmoscope should come on when you lift it off the wall. However, if it does not, there are a couple of things to check first. The dimmer switch is in the handle. It is possible that the examinee before you may have inadvertently left the dimmer switch down, so do check that first. Then it is possible that they may have turned the power switch off. The otoscope light should also come on when you lift it off the wall. Again, the dimmer switch is in the handle. Please use care when examining the ears with the otoscope. The otic speculums are disposable. Throw them out when you are done. There is a clock on the wall in each exam room. It can be used to assist in managing your allotted time for each patient encounter, and can also be used to recheck the vital signs of the patient if you feel it is warranted. However, the official exam timing is maintained by the automated announcements. If you wish to dim the lights in the room, there is a switch nearby. If you activate that switch, the large overhead light will go out, and a small light comes on so that the room is dim but not completely dark. On a small shelf next to the exam table, you'll find tuning forks and reflex hammers. There are jars with tongue depressors, cotton balls, and cotton-tipped applicators. There is also a small jar with toothpicks for pinprick sensation. These are all disposable. Throw them out when you are done. Next to the sink, there's a small jar with alcohol wipes, and then the sink with soap, water, and paper towels, and a cup dispenser. The water is drinkable. There are also boxes of latex-free medium and large gloves. Please wash your hands with soap and water before each examination, or wear gloves. If you have any skin rash or open cuts on your hands, please wear gloves. And then there is an eye chart that says eye test chart for 10 feet, and the rooms are about 10 feet in length. There are a few features of the exam table to point out. At the foot of the exam table bed, there is an extension for the patient's feet. There is also an extension with a small step stool for the standardized patient to step on or off the table.
Step down from the table and walk across the room to the door and right over back.
To raise the head of the bed, lift the head of the bed. To lower it, there's a small silver metal lever on the side of the exam table. Push that lever, but be sure to hold on to the head of the bed so it doesn't come down too quickly. If you have any problem with the equipment in the room, open the door and wave to the proctor. They will be happy to assist you. Don't leave the room. Concluding the patient encounter. After 10 minutes, you'll hear an announcement. There are 5 minutes remaining in this patient encounter. Once you're through with the history and physical exam, conclude the encounter. Be sure that you have all the information that you need before leaving the room, because once you have left, you won't be able to go back in. If you've left something behind in the exam room, just let the proctors know. They will be happy to go back and get it for you. You may not go back into the exam room yourself. Doing so may be considered to be misconduct and will be reported. This patient encounter is now over. You must now leave the room. After the patient encounter, you'll complete the patient note. This is the medical record for recording the information you obtained during the encounter. You'll have 10 minutes to complete the patient note. If you leave the room early, you may start the patient note early, and that time will be additive. You may either write or type the patient note. But once you select the format for a given encounter, you must continue that format throughout the encounter. The formats for both the written and typed patient note are quite similar. The amount of space is comparable for both. If you choose to write, use only the front of the page. Notice the perimeter of the form. There's a black margin there. Marks outside of the black line will not be picked up by our scanners, so please keep all of your writing inside of the black box. You may cross out, but keep the patient note legible. If you're typing the patient note, you are using a standard word processing format, and the space that you have is slightly larger than what is on the screen, so there's a scroll bar on the side of the box. Please note the progress bar at the bottom of each field. It will let you know how much space is remaining while you are typing. If an error message appears, contact the proctor immediately. Do not press any keys or attempt to correct the error. Typed patient notes are automatically saved, and information will not be lost if there is an error. You may refer to the examining instructions while completing your patient note. You do not need to get the proctor's attention or permission to check it. You may list the vital signs if they are particularly relevant to the case, but in general, the patient note is for recording pertinent positive and negative history and the physical exam findings relevant to the patient's presenting problem. Try to be as specific as possible when you are writing up the elements of the physical exam, and try to avoid simply writing the term normal. For example, if you find equal sensation bilaterally on a neurological exam, write that instead of neuro exam normal. List up to 5 diagnoses in the approximate order of likelihood. The diagnostic workup should represent the first-line tests you would like to use to narrow down your differential diagnosis. Examples include blood tests, X-rays, CT, EKG, urinalysis, diagnostic procedures. Try to be as specific as possible when ordering diagnostic tests. CBC, electrolytes, and urinalysis are fine, but not the more general terms such as chemistry or SMAC or LFTs. You have 2 minutes to complete your patient note. The workup should not include therapy or management, so it should not include drug treatment, therapeutic procedures, or operations, nor should it include consultations, referrals, or dispositions such as admit patient to hospital. A list of acceptable abbreviations will be available during the exam. These are the abbreviations that we are guaranteed to understand. The patient notes are read by practicing clinicians, so use your judgment. When in doubt, write out the word. When you hear the announcement to stop writing, immediately stop writing or click Submit, and then Yes if you are using the patient note program. Stay seated as the proctors collect the patient notes and the scrap paper for that encounter. The scrap paper is shredded and not used for any type of scoring. Do not continue to write or type after the announcement to stop has been given. If anyone is observed writing after the announcement has begun, the administrator on duty will be informed and an incident report will be submitted to the USMLE. Remain seated until the proctors tell you to move to the next station, and wait until the announcement tells you to start the next encounter. At the end of the exam, you will be asked to complete a brief survey. Your responses will be strictly confidential and will not affect your scores on any step administration. All patient encounters are monitored. There are video cameras and microphones in each examination room. The recorded information is used for quality assurance, training, and research, but is not used for scoring. Any attempts to gain information about case scenarios or to share information on completed examinations are strictly prohibited. In fact, any cheating or disclosure of test materials may lead to permanent exclusion from the examination system. No discussion of cases anytime or anywhere, including the hallways, break rooms, after leaving the center, or on the internet, email, or listservs, is allowed. Any disclosure of test materials could lead to being barred from all USMLE examinations. Before the exam begins, a staff member will be available to answer your questions. Remember, when in doubt, just do what you would do in a real patient encounter.